I'm Dr. Sankaranaryanan. I'm the head of the screening group in the International Agency for Research on Cancer, which is part of the World Health Organization located in Lyon in France. I have come to the conference today to deliberate on what feasible cervical cancer early detection and prevention methods that we can use, particularly in sub-Saharan African countries. So this meeting has been organized by an organization called AfrOxs, who are looking into the possibility of accelerating the availability of effective cervical cancer prevention programs in sub-Saharan Africa. There are several ways of preventing cervical cancer. In fact, this is the most preventable cancer. It's caused by a virus called human papillomavirus. One of the 15 types of human papillomaviruses cause this. So if you can prevent infection with this human papillomavirus, you can prevent it. So one of the emerging ways of prevention is using a vaccine which has been developed against this particular virus. At the moment, there is a vaccine which gives protection against infection with HPV types 16 and 18, which are known to cause 75% of the cervical cancers. But the problem is the vaccines are very new and they've been in the market for the last few years. And they are, as any new product development, the vaccines are quite expensive, and eventually the prices will go down, we expect. So eventually they can be integrated into the national immunization programs. We are all looking forward for that opportunity. The second way of preventing cervical cancer is, as you all know, by screening. And in developed countries over the last 40 years, using screening with the pap smear has reduced cervical cancer incidence and deaths by anywhere between, say, 60 to 80%. But unfortunately, implementing the pap smear programs in developing countries, particularly in sub-Saharan Africa, can be very challenging because there are no cytology laboratories, there are no trained cytology technicians, pathologists, and it is difficult to call women back, who are positive on the pap smear. So there are many, many challenges in introducing a good quality, effective cytology programs. So fortunately, there are some accurate alternatives for pap smear. One is based on visual screening with acetic acid, vinegar, or with lugolcidin. This is just apply acetic acid or lugolcidin on the cervix and look at the cervix, so you can identify color changes like a white lesion following application of vinegar or an yellow lesion following the application of lugolcidin can be indicative of the very early precancerous lesions. As you know, screening relies on identifying the very early precancerous lesions and treating them effectively by simple methods. So this is one approach, visual screening, which we think is feasible. But it has, again, certain limitations because we have to train people, and this is very subjective because the performance can vary between person to persons. The second approach is a high technology approach, detecting human papillomaviral infections. Since we know human papillomaviruses cause cervical cancer, a test which can detect women who have been already infected with the human papillomaviruses, then you can target these women for focused diagnosis and early detection of the precancerous lesions and then treat them effectively. So HPV testing is a very promising approach for screening and prevention of cervical cancer. At the moment, there is a commercially available HPV test, which is hybrid capture 2, which is somewhat expensive and requires a sophisticated laboratory infrastructure. But in the near future, thanks to the support from the Bill and Melinda Gates Foundation and the leadership provided by an international organization, a non-governmental organization called PATH, in the near future, there will be an affordable HPV testing available, which is called the CARE HPV test. We all look forward to this.
Well, I actually wanted to ask a bit about PATH, because we're going to be going out to see the demonstration project in Uganda. And I wanted to ask, what do those demonstration projects mean for the future of cervical cancer?
These demonstration projects will be very facilitative for accelerating the introduction of effective screening programs using some of these new technologies. And in fact, I personally believe such demonstration programs will showcase the feasibility and the effectiveness of such approaches. so that national governments and national authorities will be tempted to replicate this either nationally and in other countries, so which will increase the demand for screening. And this will also sort of catalyze the rapid or the fastened introduction of the commercially available HPV tests, the care HPV tests particularly. And then eventually, as the demand increases, this will drive down prices. So overall, this will be a very, very positive. This will have a very positive impact on the introduction and sustenance of programs, cervical cancer prevention program using screening in developing countries.
And I mean, if they're just demonstration projects, though, they'll come to an end. Won't that be the end of it?
Not necessarily. A demonstration program, as you all, aware, it is to demonstrate, what works and what doesn't work. And naturally, you think of a continuity of the program. And to me, an external assistance is something which catalyzes things. But expansion and sustenance of programs is not within the feasibility or within the responsibility of the external donors or non-governmental organizations or international organizations like WHO. They can only catalyze things. It is the responsibility of the national authorities to pick the leads from such demonstration projects and make them expanded throughout the countries. So I would ultimately think the follow-up of the demonstration programs, expanding the demonstration programs into regional and national programs is entirely a national responsibility. The country should take charge of expanding by expanding the interventions which are effective and cost effective and have been shown to work.
So the next step is for governments to pick this up.
Exactly, the government should pick it up. The demonstration programs are catalytic, but development and sustenance of programs is a national responsibility. The conferences like the AfrOxs conference here and other national and international conferences are excellent media to sensitize people, planners, key clinicians, key public health officials, politicians, practitioners, a vast variety of health service personnel, and the lay public and health advocates to know what is going on and make them think why this is not happening in my own country. So in my view, they are catalytic in their own right.
Perfect. Thank you very much indeed.